Thank you for joining us in this presentation on EMS services in Carbon County. First, I'd like to start off with this is a group effort. Red Lodge Fire and Rescue, Joliet EMS, and Clarks Fork Valley Ambulance, or Bridger, got together this last fall to try and come up with a solution to help all three organizations continue to provide EMS services to Carbon County residents. What we're going to do is going to start off with a little bit of history on our current situation on a state level. In 2020, EMS services had a report. The state released the Emergency Medical Services in Montana Crisis on the Horizon. What this did was it examined ambulance services within the state and analyzed where they're struggling. And then what they did find is rural services are suffering the most from a number of things. A lot of those things are in these 5 points. They have issues with staffing, funding, training, medical direction, and leadership. And so as we go forward with this talk, you'll see where some of these things come into play. And I think this is a good quote on the side here. Considering we are here for the well-being of the general public, I think if the general public knew of the hoops that we have to go through and the lack of support that we get, I think they'd be outraged just as much as we are. And in Montana, ambulance services are not a mandated or considered an essential service, unlike fire and law enforcement. So communities are not required to provide services, ambulance services to their communities. But what we're going to do is take a look at a couple agencies in the state that are struggling. So the first one is Granite County, Montana, home to Phillipsburg and Discovery Basin ski area. Granite County had a volunteer agency. That volunteer agency suffered from those 5 items that I showed you earlier, and that volunteer agency ultimately collapsed. And within the last 3 years, the county had tried to contract out with Eagle Ambulance Service to provide a private solution for ambulance service. What Eagle Ambulance realized, it took about a year, was that they could not survive. They couldn't make it work to provide ambulance coverage. They just didn't have the call volume and the population. Eagle pulled out, and then Coast to Coast EMS came into play. And they're unfortunately realizing that same thing, that with these small communities, ensuring an ambulance response is a really hard thing to do. It does not make financial sense. EMS really is not a money-making enterprise. And so it's not going to be a surprise if Coast to Coast within the next 6 months is no longer providing services to the Granite County area. Just north of us in Laurel, Laurel EMS is sharing in the same struggles as well. In 2023, they had 177 times when the ambulance was unable to respond to a 911 emergency. That is a failing service. And Laurel recognized that. They got some leadership in there that were able to come up with a solution, and they were asked the voters and passed a 50 mil levy to address their volunteerism, their staffing shortage, and operational challenges. And just a reminder that Red Lodge, or the Carbon County EMS levy, is asking for 18 mils. So this is a reality in Carbon County. We are experiencing struggles, specifically in the Joliet and Bridger areas. So this is a quote from Robin Harper, who's been a lead paramedic with Joliet, and has been doing this for 24 plus years. The way things have been operating is totally unsustainable. We are having trouble recruiting, training, and retaining volunteers. We're having trouble replacing vehicles and equipment. There are times when there is no one to answer a call for service, and we have to rely on neighboring agencies, which greatly increases the time for an ambulance to show up. We need to figure something out now at a county level because it's a county issue and it's only going to get worse. So what are the struggles that Joliet is having? Well, they are having difficulties with recruiting, retaining, and the participation of their volunteers on the organization. They currently are a volunteer-only organization. They have 22 members, but a lot of those members are inexperienced and are looking and wanting to get that experience so they can provide services. But there is a level of challenge there because you need to have that person teamed up with someone with experience, and trying to coordinate those things are a serious struggle. And so we have some issues in their operations for getting the ambulance out the door. They do have that ALS ability. Robin's a paramedic, and they have a few other paramedics that are on the roster, but they can't guarantee paramedics' response. Those other paramedics have other jobs and cannot be committed to a schedule, and they can't fill in that 24/7 idea. Joliet experiences 225 plus calls a year, and that was basically what they did in 2022. In 2023, they dropped about 23 calls for service. When we say drop the call, it basically means that they could not respond to the 911 call in their community, and so someone else, and a lot of times it's Red Lodge Fire and Rescue, responds in their place, which means response times are then longer. Year to date, they've had 11 drop calls. And how does Joliet get their funding? They only receive funding from either donations or the services they bill for. And when you're trying to staff a service 24/7, the call volume of 225 calls a year does not sustain a department based simply off of billing. It's just not financially there. Not to mention, billing is not profitable. We collect 50% in general. This is a national standard. 50% of what you build is typically what you get back. And so EMS billing in itself is a bit of a nightmare. I've taught so many EMT classes over the years, and I just can't do it anymore. The time I put into it doesn't fix our volunteer issue. It's a quote by Roger Steffen with Clark Fork Valley EMS or Bridger. He's been doing this for 30 plus years, and he's been teaching classes for pretty darn close to 30 plus years. And it takes time to teach classes. An EMT class is at least 120 hours of classroom time, plus the additional hands-on practicals that they have to experience as well. And so putting in all this time and then the return on those classes isn't necessarily the best, and it can be a little bit frustrating in terms of teaching these EMT classes. So Bridger is a volunteer organization as well. When we started this ballot initiative, they had 11 volunteers, and they are actually now down to 8 volunteer members. So they are having that struggle with recruitment and retention. They have ALS ability, but they can't guarantee it, just like Joliet. Of their 225 calls for service in 2023, 3 people covered 84% of those calls. So you can imagine that if 1 or 2 of those people either leave, get sick, get hurt, or just can't respond for whatever reason, that's going to be a major strain, and it'll compromise Bridger's ability to respond to 911 calls. 2023, they had 10 calls that they couldn't respond to. And again, this is another agency that is receiving funding from services billed, but really, in essence, that's really all they're getting. So we have these shared struggles of limited funding, deteriorating agency morale, which I'll touch on here in a second, but also the struggles with recruitment and retaining volunteers, the number of calls that are going unanswered. We've got that reliance on mutual aid, which is increasing. They've got the longer response times, and ultimately they're just a few events away from failure. And so talking about that agency morale, this really paints the picture of how this occurs. So EMS is a difficult job. There are dangers to our providers: physical injury, mental health drain, communicable diseases, and occasional violence. However, responding alone or knowing there are calls they cannot get to is one of the most difficult things they can deal with. Not being able to provide the help that a patient needs can be a heavy burden. And so this was from Laurel EMS, who we touched on earlier. And this is what happened with Laurel. They started to drop calls, and they had responders, some that were able to go on a call, but they couldn't find a partner to join them. And that means they can't go on the call, or that response to that call is long. And then some of these calls, they are life and death situations. So every minute counts. And knowing that that's happening and knowing that you can't do anything about it takes its toll on those providers. And then when you get this reputation that, your agency is dropping 911 calls, you can't respond. Your association with them is not a badge of honor. It's the opposite. And so we want to prevent this trend from occurring, because getting out of that hole, that negative attitude, that negative morale, is really hard to dig ourselves out of. And so that's what we really tried to do last fall. This quote here is: "True prevention is not waiting for a bad thing to happen, it's preventing things from happening in the first place." And so in 2023, the summer of 2023, we asked people that lived in the Red Lodge Roberts Ambulance District to change the way we fund our organization. We wanted to go from a fixed fee to a property tax levy. And that ballot initiative failed. And ultimately that failed because we did a poor job educating the public. We put faith into our support in our services or in our agency, but that wasn't enough. And so that's why we're doing these presentations and slideshows. We are wanting to get the story out there so people can understand what's going on. So why is Red Lodge specifically asking for money? Well, we know what funding can do for an organization. And so in 2010, Red Lodge Fire and Rescue was suffering. They were having difficulties providing services to the area. The ambulances were old, the cardiac monitors were old, they are experiencing longer response times. They didn't guarantee advanced life support. They didn't have that funding to ensure a good organization. We didn't have sleeping quarters, and we had a number of things that we were starting to roll into an agency that was struggling. And so what we did in 2010 was we created and had a ballot initiative to create an ambulance district. And in that district, the residents, who, if you lived in a residential home or a business, you would pay a $69 flat fee. And that fee was only for occupied buildings or occupied homes or businesses. And so that provided the funding that Red Lodge needed to improve upon itself. While at the same time, Joliet and Clark's Fork Valley didn't take this approach. They didn't jump on board, or they didn't feel like they needed that assistance. And so since over these 14 years, what has Red Lodge been able to do with that funding? Well, we have scheduled paramedics, meaning we have a paramedic on shift 24/7. We are able to establish these quick response units so our paramedics can get on scene for the true 911 emergencies where time is of the essence. We can have someone on scene and responding. We were also able to get our paramedics trained in critical care, paramedicine, and this is super important for interfacility transports of patients from Billings, Beartooth Billings Clinic to Billings for further care. We additionally established a community care or community integrated health program that helps with non-emergency services in the community. We organized and built sleeping quarters within our department so that our paramedics can be on site 24/7, and it also allows our volunteers to spend the night so we can have that quicker response time from an ambulance. Meeting rooms were also added so we can do training, host CPR classes, host EMT classes, and train for just our membership in general. Additionally, we had added some administrative positions ultimately to coordinate all the efforts, look for additional funding for the department, as well as kind of all the back end behind the scenes work that goes into maintaining an organization of this size. And ultimately that led to us getting the 2022 Montana State EMS Agency of the Year. So the picture we're trying to paint here is that Red Lodge received funding in 2010, and currently in 2024, we're a story of success. We have over 50 plus volunteer EMTs within the department. We have a combination department with insured paramedic response on our first calls for service. We have a very robust and excellent training program. We have regular scheduled training every month throughout the month. We've been able to address our 60% increase in call volume. We cannot recall the last time Red Lodge Fire and Rescue was not able to go on a 911 emergency because of staffing or any other issues. In fact, last year we had a moment where within a 1 hour or an hour and a half time period, we had 4 simultaneous calls running at the same time, and we were able to staff and respond to all 4 of those calls. And then on top of that, we consistently and regularly provide mutual aid requests to Joliet or Bridger EMS. In 2017, we were able to establish a community integrated health or community care program. Community care is really about prevention, so preventing 911 calls, medical 911 calls. We do this in a number of different ways, but ultimately it is things like helping people get to doctor's appointments, doing a follow-up check with a patient that might be at home and we're just visiting with a doctor at the hospital, and we just need to make sure they're doing okay, they have their medication or prescriptions that they need filled, make sure their vitals are appropriate. And so we prevent people from getting further sick or injured by providing these home visits. Other things the community care program does, swing bed transfers, meaning we might have a patient here in Beartooth Billings Clinic that needs to get transported to Billings for a procedure and then back again. And that's not an emergency thing, it's something that can be scheduled out. And so that is something that we also offer. We also will do hospice patient transports or patients that are non-ambulatory that need to get to the hospital and back again. And we do those frequently. Additionally, we also offer blood pressure clinics at the senior center, diabetes education, and those are events that where we interface with the public and educate them on issues. Another thing is fall prevention assessments. So we may have a community EMT go to someone's home and assess it for the risk of falls. As we have an elderly patient, as time goes on, things don't work as well as they used to, and some everyday items actually increase your risk of falls. So things like throw rugs and oxygen tubing, there are ways to work around those things or just take them out. And these community EMTs will make that assessment at the home to reduce the risk of a patient tripping or falling at home. And we talked about the EMS Service of the Year in 2022. So we did, in February, release a survey to the public of Carbon County to assess what they thought about EMS in the county. So we were able to get 750 participants in that survey, which was a decent turnout. So when we're asking residents information about the ambulance services in their community, it was targeted to where they live specifically within Carbon County. So if it was a Joliet resident, then the questioning was focused around Joliet. But overall, everyone that took the survey, or almost everyone that took the survey, did think there was it was super important to have ambulance response. So making sure that an ambulance shows up when a 911 call happens. 98% of the survey takers thought EMS agencies or ambulance services were important and integrated in our community. They're positive effect for our community. What's some of that integration? We're looking at our community care program, which we spoke about. Standby events, we have high school footballs, rodeos, big events require ambulance services to be present at those events. And so that is a super important aspect of our community involvement. CPR and EMT classes, we on a regular basis put on CPR and EMT classes to the public. We have a high school EMT class in the fall where we teach a number of students on every day, Monday through Friday, on how to become trained and licensed as an EMT. Other things that I mentioned earlier was the lift assist, so helping people that may have fallen when they were at home and can't get themselves back up. That's a frequent occurrence that probably isn't realized by the general public, but it is something that's out there and happens. 99% believe quality equipment is important. And so that's a good thing for us to see, is that, the public wants us responding in good equipment, working equipment. 90% are confident in the services we provide, which I think is a pretty outstanding number for our providers here. 97% think mutual aid is important, meaning our residents think we should help each other out. So Joliet should help Red Lodge, and Red Lodge should help Bridger. And so it's recognized the value of mutual aid. One thing that surprised us was the if you or a loved one has been transported by our agency, and we had 43% of the survey takers said they had been. And what this tells us is that we do have a wide reach in our services. It's not just tourists that are coming in from out of town. A good portion of our response for calls are our residents. So we're being utilized by the public, and I think that's an important thing to recognize. Ultimately, our three big takeaways from the survey is that the ambulance service is very important to the community. From those that took the survey, they ranked it very high. We're expected to help our neighbors, so we're expected to provide mutual aid. And then residents want us to have quality equipment and well-trained responders show up on scene. So if this levy passes, where will the money go? Well, the money will ultimately go for us to maintain the level of services we already provide. So keeping that ALS, the fast ALS response, to continue to recruit, retain, and train all of our volunteers. Having that reliable equipment in our ambulances, keep our community care program going. The community care program is one of the things that would be considered on the chopping block if the ballot initiative does not pass. Community involvement, ensuring that we keep teaching EMT and CPR classes. I believe I mentioned it, but we teach a large number of CPR classes throughout the year. We'll teach high school students, we teach hospital staff, our own providers here locally, but other organizations as well. The power company, the mine. We have a large variety of people in the public that receive CPR training, babysitters. Also, we would continue our transfers to Billings, ensure people are able to receive that higher level of care without getting the cost of a helicopter service. And overall, just ensure safety for our responders. And so let's take a look at EMS as a system. So there's a lot of components behind EMS. And so if we just took a look at a 911 call and how it looks to a volunteer, I think this gives you a level of understanding of what they do to provide services. So a 911 call gets called in. They call 911, dispatcher answers, and they page out an agency. In this case, it would be Red Lodge Fire Rescue. So Red Lodge Fire Rescue volunteers see this call come over their phone, over a pager, or over a radio. And if they're signed up to respond to these calls, they would enter that status in their phone, and then they would drop whatever they're doing, whether it be at work, at home, or maybe it's 2 a.m. in the morning and they're sleeping. They get up and get themselves to the station to grab an ambulance. Once they're at the station, they team up with another person, jump in the ambulance, and go en route to the scene. Once on scene, they assess the patient. Then they load the patient into the ambulance, which might sound pretty straightforward, but a lot of times this involves navigating stairs, carrying people, getting them to a cot. There's all kinds of lifting and moving and rearranging that takes place. Sometimes this is the longest part of the call because of the complexity of the environment. Once they get in the ambulance, they do treatments as they're en route to the hospital. Sometimes we'll go to, or most of the times we'll go to Beartooth Billings Clinic. However, there are times when we might just go to Billings, to one of the two major hospitals there. We'll unload and deliver the patient to the ER and then give that that ER patient report. And then we've got to clean our stretcher and ambulance, decontaminate everything, wipe it down, sterilize it, get back to the station, restock our supplies, and then finish our patient care report, because that is something that has to be done right away. And then ultimately the call ends, and then the volunteers can get back to work or get back to bed. And so this whole event can last anywhere from an hour, hour and a half. Worst case, if they have to go to billings, you're looking at 3.5 to 4 hours of time that our volunteers have committed to respond and help the community. So the response time, we're talking about response time, we're talking about how long it takes from the 911 call, for a paramedic or an EMT to get on scene treating the patient. And so there's not much we can do in terms of addressing those times that we haven't already done. So really the biggest thing for us is to have for full-time personnel on scene, ready to go at a moment's notice. If you have that staff at the station, you can respond within 1 to 2 minutes of getting that call. And so that's what we have here at Red Lodge Fire Rescue, and that is potentially what is at risk if this ballot initiative doesn't pass. So having that paramedic here, and then having the sleeping quarters, which allows not just the paramedic but other volunteers to spend the night and be here as well, so we can get an even more robust response, are super important. The quick response units, that allows the paramedic to get on scene first, while at the same time a volunteer responds from home, gets to the station, gets into an ambulance, and then goes on scene to rendezvous with that ALS provider. And so the system that we have is pretty efficient, and it utilizes a few things, and it allows us to provide response out the door times of 1 to 2 minutes compared to a volunteer only organization where you have responses of 10 to 20 minutes until they're out the door. This is one of the survey results of expectations of how many calls could be run at the same time. Red Lodge Fire Rescue, in fact, has had 4 calls at the same time at one time, and have been able to staff that. But this is a survey from the entire Carbon County population, and the reality is Joliet and Bridger EMS are only able to respond to 1 call at a time, and that's due to either staffing issues or volunteer issues, or equipment. Both agencies have their second ambulances are not reliable, are frequently not working or in the shop. And so in those communities, Joliet and Bridger, Narcotics Fork Valley, ambulance response with a second call is highly unlikely to occur. We'll talk about interfacility transfers, and interfacility transfer is going from one hospital to another. And in Red Lodge, that happens quite frequently. Probably 40% of our 911 calls end up getting transported to a different facility, whether it's Beartooth Billings or whether it's Billings Clinic or St. Vincent's. We are usually asked to transport the patients from Beartooth Billings Clinic to Billings. And so what are the transport options? We're looking, at a local option. So Red Lodge Fire Rescue. We've got air, helicopter or fixed wing, but those services are significantly more expensive. You're talking tens of thousands of dollars instead of thousands of dollars. regional response, so regional being maybe ambulance service from Billings, uh, which is you would see similar costs. However, timing and response time is significantly increased when you're asking an agency from Billings to respond to Red Lodge for transport. And the other reality is those services are not reliable. We have experienced a number of delays with services that were in Billings. Those communities are having their own struggles to provide service, and so the reliance on a service from outside the community is not really there. I talked about the Jeep role in quick response. We had this comment, maybe too many new fire trucks or command Jeeps that drive everywhere. Well, the command Jeep isn't necessarily a command Jeep. It does at some capacity serve as one. However, we also look at this Jeep from the outside. It looks like just a cool 4x4 vehicle, but on the inside to us, this is a response unit, meaning it has pretty much all the equipment that a ambulance has, but it's in the Jeep. So this allows, as I mentioned earlier, this allows our paramedic to get on scene, start treatment until the ambulance arrives, and then they can continue care further on. And so again, we're talking about the new equipment, and if you take a look at these two pieces of equipment, they're looking pretty shiny and new, but in the reality is that if I can get it to pop up here, these are this ambulance here on the left is 22 years old with 150,000 miles, and the Jeep on the right is 12 years old. So these are not new pieces of equipment. They're actually well used. But the big factor here is that we take care of the equipment. So we're responsible for, we care for the equipment that the taxpayers' money buys. And so we have Stephen Maxwell here who does an amazing job washing our apparatus and our equipment, and does it on a regular basis. So all of these pieces of equipment that we see around town responding on calls, they're well taken care of. And so what does replacing one of these pieces of equipment look like? So a 4x4 ambulance, like the ones pictured, you're talking about a total, with it fully equipped with all the equipment you want on it or need on it, is about $350,000, all said and done. So it's not a small price. It's a hefty price tag to get a replacement ambulance with what we need on it. Another thing we want to look at is administration and leadership. So in the background of Red Lodge Fire Rescue, we have a lot of stuff that's occurring. We have our QA, or quality assurance, and so making sure we have patient care report review. So we are assessing our care that's given. We have medical direction coordination, meaning we talk with our physician, who is Dr. Oli. We talked with him on a regular basis to make sure the care we're providing is good and to keep up with current practices in emergency medical services. Billing service and compliance and licensing. So there's a whole nother can of worms there in terms of being compliant with Medicaid services so we can bill for EMS services, as well as billing out and collecting for services rendered. The state of Montana has its own compliance requirements, and we get inspected every 2 years. And so maintaining the equipment that they want us to have, as well as keeping up with their standards and their reporting requirements, is another undertaking. Coordinating repairs, equipment repairs. So if we have an ambulance that breaks down, it's not as simple as going to a local shop. A lot of times we end up having to go to a large vehicle garage where we can repair what's wrong with an ambulance. That means getting an ambulance to Billings. And so coordinating and ensuring that those pieces of equipment get fixed, you need to have some leadership or employees there that can help coordinate and arrange those repairs. Inventory and tracking, that is a large project to do. Workers' comp, we want to make sure our volunteers are covered if they get injured, and make sure we're compliant with all those requirements. Grant writing is another way we bring in money and funding and equipment to the agency. That takes time, and it's a lot to ask for a volunteer on top of already responding to 911 emergencies to then turn around and write a grant. Event scheduling of services. We have all these unique events in this community where an ambulance is required, and making sure we have that recorded, processed, have people sign up for it, make sure people are signed up. Again, some more effort behind the scenes that's not necessarily something a volunteer wants to do. Mentorship. So our 4 hired paramedics have all come here with previous experience, and that experience is something that they pass down to our volunteers. It gives the volunteers a sense of confidence when they're going on calls, but also they're able to ask questions and learn from the calls that they do experience. And that mentorship is super valuable in building up a strong EMS response system. Recruitment and retention are 2 things that take a lot of time and energy. We don't have people knocking on the door lined up, ready to volunteer. There's requirements for training. There's requirements for licensing, and then we do have to reach out and entice people to come in and volunteer in order to keep our membership going and our agency strong. And then we also have minimums in our system that our volunteers have to perform at certain levels or volunteer a certain number of hours each year. And so tracking those hours is another undertaking. And then training is another big part of our organization, ensuring that we offer a variety of training to our EMTs and paramedics, and making sure we have a consistent and reliable schedule behind that. It's another important aspect of the administrative and leadership side of our organization. So we talked about that volunteer recruitment and retention. So it is a national issue, volunteering or having volunteers. It's recognized on a national level. Our average retention is about 2 to 3 years. So we put a lot of work into a person to get them onto the agency, but there's a realization that they end up leaving in 2 to 3 years. Probably for every 5 volunteers, we get 1 that'll last more than that 2 to 3 years. Volunteers are investments, so we put time and energy into that training and into the equipment. They have personal protective equipment and uniform, and there's a bunch of costs associated with a volunteer that we need that funding to ensure, and then maintaining positive culture. So, as part of that retention aspect of this, you want to have a place that people want to come and train, and they want to come and talk to other volunteers, and you kind of have this sense of community, and that all takes time and energy to ensure. So, what's it look like to be a volunteer? So, for a person with Red Lodge Fire Rescue, you have to have 288 hours where you're signed up, ready to go on a call, or respond on 25 EMS calls. And then we have there's a state requirement for 24 hours of continuing education or training. Our volunteers, I'm proud to say, go above and beyond those requirements um, for training. And in 2023, our cumulative hours for all of our EMS volunteers is over 14,000, almost 15,000 hours recorded. There's a lot of hours that are still out there that don't get recorded. Things like um, showing up to events downtown, swinging by the station to take care of something. Um, those are things that typically don't get recorded but do occur. So let's talk. So if you look at Red Lodge Fire and Rescue and its funding, currently as it stands, our EMS fee that we collect from the residents um, is sitting at 16% of our overall income. This is looking at Red Lodge Fire Rescue as an entire picture of the fire and the ambulance services. Um, so that EMS fee makes up a small portion of our budget. However, it is a critical, vital, important part of our budget because it allows us to um, make large capital purchases such as ambulances and cardiac monitors, and it gets us the equipment we need. The other important thing is that we are a volunteer agency. And so if you were to put a price tag on the hours that our volunteers contribute, those volunteer hours would ultimately make up a 27% factor in services or saved costs. So if you compare that to the rest of our budget, um, it's a significant chunk of money that our volunteer providers end up giving Red Lodge Fire and Rescue. So what's this going to cost for our residents? Well, first let's look at what other communities are paying. Uh, so if we look at the city of Laurel, they just passed a 50 mil levy this last year, compared to what we're asking for is 18 mils. Kalispell recently approved a 60 mil levy on top of the current mills, but they just passed a 60 mil levy. And then Lockwood Fire Rescue, if you were to take a look at that organization, for their fire and EMS, they are currently operating off a 163 mil levy. If you were to take a snapshot of Red Lodge Fire Rescue with EMS and fire factored in, and you were to say, if we imagine this ballot initiative passing, we're sitting under 50 mils for both services. So the reality of what we're asking is not much compared to other communities and organizations. And just to show you what our response was from the community, 87% of survey respondents said they would be willing to pay $5 or more per month. This kind of shows the impact throughout the community of what people will feel if this levy or ballot initiative were to pass. So you're looking at 26% will actually pay less compared to the $69 they already pay. You've got 23% that will pay $0 to $2 more a month. And then you have 23% that will pay $2 to $5 more. And then the remaining will pay over that $5 amount. So the impact varies depending on, again, on property value. But what this ballot initiative also does is it collects money from centrally assessed properties, meaning things like the pipeline, wind farms, things of those natures that currently don't contribute to EMS funding in the county. Here's a nice graph of what the 18 mills would look like depending on your home value. And so you can see that $300,000 level is seeing minimal increase in property taxes. The median home value in Red Lodge Roberts district is between 300 and 400,000. So when this funding comes in, what's going to happen with it? So the proposed disbursement is 25, 25, 50. This was something that was pitched to the county commissioners. Ultimately, the county commissioners decide the funding structure for this. However, all three agencies agree on this disbursement model. How did we reach that model? Well, if you look at our call volume, Red Lodge has 62% of the call volume. Joliet and Clark's Fork has 18 or 19%. If you look at population, again, you're looking at that 50, 25, 25. And so who are your responders? Well, your responders are your neighbors, your friends, people at the store, people you're in line with when you're buying a cup of coffee. They're pretty much anyone in the community. And so this is a community organization. We have a multitude of responders who have a multitude of different careers, whether it's a dispatcher, a contractor, a lawn service, a rancher, a hospital employee, someone that's works the gas station, or works at a coffee shop. We have a large variety of people that volunteer their time to serve their community. So what's the other option with all this? If this ballot initiative is unsuccessful, we are going to have to investigate cost-saving measures with Red Lodge Fire Rescue. But this was a quote from one of the survey takers. I would much rather tape a hanging limb on and have my spouse drive me to the hospital than wait half an hour to pay for an expensive taxi. And I think this is an extreme to that case. However, I think what this commenter doesn't realize is a lot of times you're unable to get yourself into a car and to the hospital. Maybe you live by yourself. Maybe you have a more of a life-threatening emergency where you're starting to go into shock. But even if you made it to the hospital, locally, you're going to need to go to Billings for further care, and you need an ambulance to get you there. Someone's not going to throw you in the back of the car to drive another hour to get to a hospital in Billings to treat you. And so the ambulance is a vital part of our community. It's a vital part in saving lives. And we would really appreciate your support in this ballot initiative on June 4th. If you have any questions, feel free to reach out to us. We'd be more than happy to answer your questions. If you have if you want specific numbers for what this is going to cost for you on an annual basis, please give us a call and let us know what your last name is and the properties you have, and we can come up with the amount that you would be expected to pay. In most cases, it's not as much as you think it is, and so please don't hesitate to reach out for further details. Thank you.